All right, we can get started. My name is Noah. I'm on the steering committee for this event. It's been amazing, and I appreciate you all coming and being here today. I am very lucky to be introducing our next speaker, Nova Bright-Williams. Nova is the Senior Director of Internal Training, Learning, and Development at the Trevor Project, the world's largest LGBTQ youth suicide prevention and crisis intervention organization. In her role, Nova leads the strategy and execution of training programs for crisis counselors nationwide, ensuring that they are equipped with the skills, empathy, and expertise to provide life-saving support to LGBTQ youth 24/7. With over a decade at the Trevor Project, Nova has designed innovative learning models, championed inclusive education practices, and expanded training capacity to meet growing national needs. She is a sought-after speaker and advocate who brings warmth, authenticity, and a deep commitment to fostering safe, affirming spaces for LGBTQ young people. Please join me in welcoming Nova Bright-Williams.
So, Gallup estimates that somewhere around 10% of the population identifies as LGBTQ in the US. In every major city across the country, however, 30% of young people in foster care, young people experiencing unstable housing, young people who have been kicked out of their homes or lived in homes where they weren't welcome are overrepresented, vastly overrepresented. It concerns researchers a lot because when you see that 10% of the population is experiencing something that is arguably one of the most adverse sort of young life events, right? Unstable housing, no longer being able to live with your family. That's really scary. So my husband and I looked at this and we said, we should probably become foster resource parents. We have the means to do that, and we have an extra bedroom. So why don't we go ahead and become foster resource parents? Takes about 6 months, elaborate home studies, a ton of stuff has to fall in place. And one day, someone from DCFS reached out to us and said, hey, we have a little girl with gender issues who needs a place to live. And after I rolled my eyes, because I'm not sure what a young girl with gender issues exactly means, I said, sure, we're happy to connect and learn more about this person's situation. And that's when we met Mason. And he joined our family about 3 years ago. His story is his story to share. So I'm going to look at this topic through my lens, from what is my story to share. And one day I was in my office, and in my office I had these characters from Inside Out on my desk. Let me see if I can, there they are. So I have these characters from Inside Out on my desk, and Mason came up to my desk and was like, why do you have toys on your desk? And I was like, oh, just because sometimes when I'm giving talks and when young people are asking about, what do we do with these big emotions that we have? I'll talk about how, have you seen that movie with the emotions and different emotions drive? And while no emotion is a bad emotion, oftentimes we have one emotion that drives the most often for us. And I said, which emotion do you think drives the most often for Seth, my husband? And without skipping a beat, he said fear, right away. And I was like, that's very true, but why did you say that? And he was like, well, because I'm 13 years old, and he still tells me to look both ways before crossing the street. And I was like, okay, makes sense. Which emotion do you think is driving for me most of the time? And he said, joy. And I said, interesting, why do you say that? And he was like, well, because you're bubbly and happy, and I just think you're always a really happy person. And I said, well, that's cool. I think probably the emotion that drives for me the most is sadness. Not because I'm always sad, but because the feeling that I think is most important in my life is empathy, wanting to connect to others. And I feel like sadness helps to drive that feeling. And then I said, hey, can you tell me a little bit about which emotion drives in your life most often? And also, without skipping a beat, he said, anger. And as a parent, you don't want to stigmatize someone's emotions, so I just said, that makes a lot of sense. You've had a lot happen to you in your life. You shouldn't have had those things happen to you. It makes sense that you'd be angry about that, right? And he said, I've lived in 10 different foster homes in 5 years. And every time I tried to tell them who I was, they kicked me out and had to go live with a different foster parent. And I'm angry about that. And I said, that makes so much sense. And then he walked away, and I just chalked it up to good parenting day, wow, we talked about emotions, how healthy. And we went on with the day, right? But I want to get at that anger piece, because I think that anger gets at a very important part of humanity, which is justice. When things are not fair, when things are not right, when the experiences that we have are not experiences that anybody should have to go through. That is not fair. And so when we look at what's happening today to LGBTQ people in this country, specifically trans young people, we see that hospitals around the country are cutting their gender-affirming care programs for minors. CHLA, in the city that I live in, was one of the first hospitals in the country to have a gender-affirming care program, and one of the first hospitals in the country to bow to the current administration and cut their gender-affirming care program. We see that one of the smallest minorities in the country, right, somewhere around 1% of folks fall into that trans or non-binary space, is also shouldering the majority of the narrative right now around political violence, around sexual violence, around the nefarious desire to destroy sports. All of these things are being placed on this one community. And that has a huge impact. Oh, I have to tell you disclosures first. I work for the Trevor Project, you heard that. And so I am partial to our research, but there's a lot of great research out there, and you'll definitely see some of Trevor's research today and lots of research across all the conversations that we're having. And all the opinions discussed today are my own and not those of the Trevor Project. So, based on some really groundbreaking research from Dr. Amy Green over there, we know that suicide is the second leading cause of death for young people broadly, but when you zero in on LGBTQ folks specifically, you see a huge overrepresentation in suicidal ideation again, right? 60% report that they experience discrimination based on their identity. 50% report wanting access to counseling or mental health support and not being able to receive it, right? Based on our research at the Trevor Project, we estimate that 1.8 million LGBTQ youth seriously consider suicide each year. That is a massive and very scary number. And that's still 4 times more than their cisgender and heterosexual peers. A huge concern. A little glimmer here for you is that if you are a supportive or affirming adult in an LGBTQ young person's life, you can reduce the odds of attempting suicide by 40% by being that affirming adult in a young person's life. And that's huge as well, right? Because a lot of times when we look at these big, scary things, we think, well, what can I do? Like, I'm just one person. I'm not really sure how I can make a huge difference in this specific area. And the truth is you can by simply being an affirming adult in the life of a young person. Now, when we look at folks who wanted to access mental health care and why they couldn't or what barriers were in place, we see something really interesting here. One, we see that the number one reason that folks report not being able to get access is that they're afraid to talk about it. Right? They just don't want to talk to someone about it for a number of reasons. Oftentimes in mental health spaces, we talk about that as stigma, right? Stigma and fear of what might happen if I do talk about my mental health. We also see that people can't afford it. Access to care is expensive. We see that people need permission sometimes from their parents or caregivers, and so they can't access it because they don't want to talk to their parents about it. And, you know, a lot of different other things that fold in here that are really important. One thing we see here that I did want to highlight is a fear that there might be police violence or negative interactions with police or emergency services. And again, digital access to mental health care can, in many cases, remove that fear of having to engage with or access police or emergency medical services in person. And that's important because we want to reduce those barriers. If you look at a list like this, though, one of the main ways that we tackle these topics is in the digital mental health space. Okay? So we look at, well, how can folks who are worried that their parents won't allow them to access it, how can they confidentially access crisis intervention tools? 988 was a huge one for LGBTQ youth. How many of you are familiar with the Press 3 option that used to be on 988? Okay, so the Press 3 option was part of the original intention of 988, which was if you're an LGBTQ young person, press 3 to be connected to a counselor who's specifically trained to support you. The current administration, with almost no notice, removed the Press 3 option and said LGBTQ youth can just get their help from everybody else. Just like everybody else. They don't need a special Press 3 option. Unfortunately, we know that's not true because of things like this. They're worried about stigma. They're worried about fear. They're worried about not accessing people who actually understand how to support them. Now, one way that we can support LGBTQ young folks, and really all LGBTQ folks, is pronouns. I do want to point out here, though, that when talking about pronouns broadly, there has been a deep politicization of this topic, right? To the point where you might ask a colleague or someone that you just met, hey, what pronouns do you use? And they'll say, I don't use pronouns. Or it's obvious what pronouns I use, man pronouns. And the I don't use pronouns is sort of ironic because they have to use pronouns just to tell you they don't use pronouns. But it also shows a deep misunderstanding of the purpose of language, right? So the purpose of language is to communicate ideas, to communicate identities, to communicate concepts and feelings. We bend language to our needs. The only reason that language exists, the only reason is so that we can communicate the ideas in our heads with one another, right? And when we need to find ways to communicate with one another, we always do. Always. And that's a huge thing here that I want to drive home. This idea that, well, language is locked in place. It is what it is and it will always be that way is not proven out through the test of time, right? In fact, Shakespeare used they, them pronouns in his work. Jane Austen used they, them pronouns and gender-neutral pronouns to refer to one person, right? We see neopronouns, pronouns that expand our understanding of how someone might identify within a space. And all of these serve to better capture the identity and the thoughts of the person who uses them. And that is beautiful. And it's wild to me that we wouldn't want to expand upon language, to expand upon our understandings. Now, there's another key point here, though, when we talk about mental health, and that's trans and non-binary youth who say that their pronouns, having their pronouns respected, most or all of the time, attempt suicide at a lower rate, right? Attempt suicide at half the rate of those who don't have their pronouns respected. Why? Because pronouns are a way to indicate to someone, I see you, I see what you're trying to tell me about you, and I want to reflect that back to you. These are simple things that we can do. And yet, it doesn't get done in every context, in every setting. It contributes to a fear of going out in public, of meeting someone in the real world, of communicating to someone in the real world. Trans youth are particularly desirous of digital and online spaces because then they don't have to use their voice. And there can be dysphoria related to one's voice and a fear of using one's voice. So if you can type your ideas or concepts, that can make folks feel more accepted as well. Again, leading them back towards digital suicide prevention resources. But you may be saying, okay, well, Nova, what can I do? Because the truth is, we are gathered here from many different backgrounds. Some of us have varying levels of influence within our professions, within our careers, within our communities. And oftentimes we might feel like, well, the problem is just too big. I can't change, the hospitals and make sure that they keep their gender-affirming care programs open. I can't change the types of protests or things that are happening in my community against care for LGBTQ youth. I can't prevent somebody from being suicidal when they live in a world that has negative narratives about their identities. But one of the things that the research seems to bear out time and time and time again is that the best protective factor across all forms of suicidal ideation is human connection. Is the ability to connect to another, to be seen, to be valued, to have your ideas respected and cared for. That is something that you all have the proposition to be able to do right now for anybody in your life. To respect, to value, to nurture, to care, to be empathetic, to be kind. Listen, I'm not telling all of you that you should go out immediately and be a foster parent just because there's a disproportionate need within foster youth for competent LGBTQ knowledgeable foster parents. What I am saying is that you can find tangible ways to uphold human connection in digital, in person, in your friends, in your friends' children, in your communities, in your spaces. And that is the number one protective factor that you do have control over. Now, earlier, I mentioned Mason, who told me that the number one emotion that was driving him was anger. And after he came to live with us, we literally just said, tell us who you are. Tell us what you like. He said, I want to get a haircut. We said, cool. Let's find a picture that you like. He said, I want to change my clothes. We said, okay. Let's go shopping and get some new clothes. So we went to buy him an all-new wardrobe because, unfortunately, in the 10 previous homes that he had lived in, nobody would get him clothes that he felt comfortable in. So we went to the boys section. He picked out, a week and a half worth of outfits. And we tried them on, we took pictures, we showed him, hey, here's what this looks like, and here's how that looks, and we bought all that stuff. And we're in the car, we're driving home, and he says, hey, Nova, guess who's driving right now? And I said, I don't know what you mean I'm driving right now. He was like, no. Guess what emotion is driving right now? And I said, oh, what emotion? And he said, joy. And he said, I don't think I can remember a time when joy was driving in my life. And I was just trying to be chill. I was like, okay, don't cry, get us home safely. But from there, we met him where he was at each stage. Hey, I think I want to change my name. Okay. What name do you want to go by? Hey, I think I want to use these different pronouns. Okay. Hey, I need help at school because there aren't any bathrooms that I feel comfortable using. Can you talk to the school? Sure. Hey, I really want to see a doctor about this. Okay. I want to start hormones. Okay. Let's talk about it. Let's weigh the risks. And at each stage in his journey, something changed every step of the way. He went from not being able to finish a full day in school, always had to go pick him up, felt like he didn't have any friends, was failing all of his classes, to number 6 in his class, all A's, to on the track to become an Eagle Scout. I didn't choose this for him, which just shows that as parents, you can't choose what your kids want. But now he's going to be an Eagle Scout in less than a year. He is thriving by every way that we measure thriving. But all that changed is affirming, loving, caring people, letting him be the author of his identity, of his space, right? And that is one of the most powerful things that we can do to support and affirm folks. This narrative that LGBTQ people are suicidal as a default setting is not borne out by any other metric that we measure suicidal ideation by. LGBTQ people are more likely to be suicidal because of the way that society has ostracized and oppressed them at every turn. And Mason is just one of countless stories of young people who, when given access to say who they are and be believed, can thrive. So I wanted to quickly see if there were any questions related to LGBTQ mental health or support, or really any questions at all. Again, I do work at the Trevor Project, and I work in training and education for counselors. So I'm happy to answer any of those questions that might come up. Yeah, in the back. I can walk a mic over. Oh, wait.
There's a mic.
There's a mic. It's right there.
Hi, I work in both 988 and also the LGBT National Hotline. And I noticed that after the option 3 was cut from the 988, there's a large portion of callers to the LGBTQ national hotline were referred by the 988. So it's not necessarily a question, but I would really love to learn more about the trainings that you mentioned, because I feel like crisis counselors and also LGBTQ peer support counselors have like this gap. Like sometimes the skill set is not synced. So do you have like any experience that you, or like future plans that you guys are doing that you want to share? Thank you.
Yeah, it's a great question. When the 988 Press 3 option was taken away, one thing that happened is that Trevor was was the largest supporter in that subnetwork. So we had to reduce force because that government funding was taken away. And there are a ton of people who are highly skilled in this area now looking for the opportunity to be counselors in the core 988 network. But one of the things that we know matches our values is that it is better to have everybody have this education in some way than to say, well, the only way to get this type of education is by being an LGBTQ specific organization. And so here in California, some funding was allocated for us to specifically train 988 network call centers in LGBTQ support. Other states have reached out and said, can we also take some of that funding and take that training that you have and spread it amongst our call centers as well? And so these sorts of things are in development now, and honestly started being in development day one when the line, when those services ended, because any counselor should have access to supporting and affirming LGBTQ folks. And it shouldn't just be people who have interest in it. It should also be people who may connect with an LGBT person in crisis and they never even knew anybody else or didn't think they knew anyone else who was ever LGBT. It's a great question, though. Yeah, over here.
Okay. What resources do you have for youth that have autism and or trans?
Okay, the question was, what resources do I have for youth who have been diagnosed with autism and the last part? And trans. Yeah. So one of the best resources for this specific topic is an organization that is based out of Los Angeles, but actually has meetings monthly called Transforming Families. And you can find their website. So that would be a great resource to start with. It will connect trans young people who are on the spectrum with other trans folks on the spectrum, as well as parents who are on the spectrum who are looking to connect with other parents with children on the spectrum, rather. I think there's no training that's complete that doesn't take an intersectional approach to how it trains. So one interesting thing about LGBTQ people is that they could be a member of every other community, right? There are LGBTQ folks who are, people of color. There are LGBTQ folks who, are deaf or hard of hearing. There are LGBTQ folks who are immigrants. There are LGBTQ folks who are extremely religious and grew up in very religious communities and seek support there. And so you really can't isolate any one other identity in the face of saying, well, we only serve LGBTQ folks, because the truth is LGBTQ folks identify in all the other communities too. And that's why research here is so hard, because there are compounding lived experiences, intersectional identities that make a lived experience very different. And we should never be asking someone to take the various ways that they're marginalized and say, well, what's the most important one? Let's just focus on that. And so this is a great question, because it says, what's this specific lived experience, and can we provide resources within that context? So I appreciate the question. I think we have a couple minutes. Any more questions? Oh, there's a question, and then one in the back.
I actually have a question myself.
Yeah.
I'm curious about, particularly in the context of your expertise, I think a lot of something that I encounter with some frequency when talking about queer and trans youth, particularly in online communities who are connecting with each other in online spaces, this sense of queer youth having to be the providers of support and healthcare for other queer and trans youth who are experiencing SI or feeling thoughts of harm, things like that, and just how important it is to build infrastructure for youth, both in these who are being put in these positions and giving them resources to help support other youth. So any just thoughts or recommendations you have on how to spread information about that, how to make those resources available to youth would be great.
Yeah. It's an interesting question because I think peer models are tested and tried and true, and lots of people do want to connect to someone who has a similar identity to them and a similar lived experience to them, and they want to talk through that. But what is also true is that we only have so much in our cup, and when our cup is spilled, it is hard for other people to then support you if their cup is spilled. And so one of the things that I think a society cannot be complete without is the village narrative, the idea that you need adults, you need aunties, uncles, nibblings, siblings. You need every single context of your community to be knowledgeable and to be able to support in some capacity. And so, like when CHLA closed their gender-affirming care program, we asked our son, do you want to go with us to the protest? It's totally up to you if you want to or not. And he said, verbatim, I'm going to let the adults fight for my rights, and I'm going to stay home and play video games. And I was like, valid, right? Because this idea that young people have to also be the core support for their community when they themselves are struggling is a very narrow view of a holistic problem. We need doctors, clinicians, parents, social workers, principals, anyone who works with young people to also have that knowledge. Yeah.
Really quick follow-up. How do you go about talking about that? I mean, there's many different ways to do it, but in particular youth, when I've talked to youth whose friends are like, whatever you do, don't tell my mom that I'm feeling this way or doing these things. How do we address those barriers to trust between youth, in particular when another youth discloses something like that to them, while also making them aware of the importance of all of these supports that you're describing?
Yeah, I mean, humans do like to gossip and to talk about things that they hear and see about their peers, and I think, it is always risky to tell a peer something about yourself that you don't want them to share with others or that you want them to keep confidential. I think one of the core ways that I think most young people, especially queer young people, who reach out to their peers for support are looking for support is not to have someone say, oh, well, you should do this or you should do that. Just have someone say, I hear you, I still love you, I still care about you, let's go. Let's keep doing what we love to do. And so what we talk about with our son, for example, is hey, if a kid comes to you and asks for help with something, usually the help they're looking for is a listening ear. Not always, but when it comes to peers, they're looking for someone to be like, yeah, I know what that's like, or I share that experience. When they're looking for big issues, when someone's safety is at risk, when somebody doesn't have the resources that they need, that's when you may need to involve an adult. That's when you may need to loop back and say, hey, here's someone who can help. And that's why adults have to be trained, because if you get the ball, to use a sports analogy, and I know nothing about sports, if you get the ball, you don't want to fumble it. And so you need to have a base level knowledge about supporting LGBTQ youth when that ball gets passed to you. Well, I know we're at time and I know it's lunch.
So can everyone please join in thanking Nova for